Hepatitis A is a virus that affects only humans and non-human primates. Hepatitis A is primarily transmitted by the fecal-oral route. Hepatitis A is endemic around the globe, with about 159 million annual cases and 15 to 30,000 deaths worldwide. Despite the varying endemicity among countries, hepatitis A virus is still circulating. WHO has identified the countries or areas at risk of hepatitis A. Travellers who get infected while abroad run the risk of spreading the disease in their communities once back home. Hepatitis A is one of the most common vaccine-preventable diseases in travellers to endemic countries. The risk of hepatitis A for non-immune travellers is currently about 1 in 10,000 per month of travel. The consequences of hepatitis A infection on travellers can be significant. Incapacitation lasting 2 to 3 months in adults, meaning a potentially long sick leave. A case fatality rate of 2.1% among persons aged 40 years or older. Risk of transmission to close contacts upon returning home, such as in schools and nursing homes, which may require significant infection control. Hepatitis A cases in travellers to endemic countries are not necessarily the product of extreme circumstances. They can occur through standard tourist itineraries, accommodations, and eating behaviours. Contaminated food and drink have been shown to be a common source of transmission in several sporadic outbreaks affecting European travellers. This includes common drinks like orange juice or fruits such as mangoes, strawberries, dates, and even frozen berries. The risk of hepatitis A infection is particularly high for travellers exposed to poor hygiene, sanitation, and drinking water control. To reduce risk of infection, travellers are provided specific advice, such as avoiding the consumption of raw or undercooked food, fruit and vegetables that one cannot peel, food from street vendors, unbottled water, or drinks with ice. However, studies have shown that risk behaviour related to food and drink is common, and that up to 99% of travellers do not follow these recommendations. WHO, North America, and most European countries recommend vaccination against hepatitis A to travellers visiting risk countries.